Time now for medical rounds, and today we are focusing on men's health. Many men struggle with getting help for health issues, especially when it comes to erectile dysfunction. Joining us now is Dr. Richard Kershen. He's a urologist at the Hartford Healthcare Tallwood Kidney and Urology Institute. Doctor, thank you for being with us. And have you found that during the pandemic, men getting help for health issues is even more of an issue?
Well, of course, at the beginning of the pandemic, it was a huge issue because people were afraid to get out of their houses. We actually stopped seeing patients live for a good time, and we very quickly, however, we ramped up to doing telehealth visits. And now we're up to being able to offer patients inpatient visits, in the actual office, live as well as telehealth visits. So we're back to our numbers, and we want to get the word out because it's Men's Health Awareness Month of November, that you should come in and seek care because we're going to take every precaution to treat you safely. And I think patients are back to feeling comfortable.
And sometimes they just need a little nudge. You want men to know they should not be ashamed talking about erectile dysfunction. How do they get help?
Absolutely. I mean, I think it's a breath of fresh air to be talking about erections and not elections. But what we want to do is we want to get the word out that men should talk to their doctor. I mean, the first thing is ED was for years a hidden condition. People were afraid to talk about it. I think in the last 10 years, with the availability of oral therapies like Viagra, Levitra, et cetera, people are more comfortable talking about it. So the first step, if you have a problem, is know that you're not alone. Many people suffer from this condition. As a first step, read a little bit on the internet. There are some excellent websites out there, like the Urology Care website, which you can reference, and go speak to your primary care doctor, because a lot of times you can be evaluated and started on treatments immediately by your primary care physician without even having to see a specialist.
In that brief time together, just a few seconds on, what are some of the treatments you might be able to get that could really make a difference?
Well, if oral medications don't work, and if lifestyle, we always recommend lifestyle modifications, weight loss, healthy lifestyle, eating right, exercise. We have a range of therapies that are available, as simple from injections. You can actually put it right directly into your genitalia, and I can give you an instant erection, to amazing surgical therapies that work, and mimic an actual erection precisely. So there's a range of non-invasive therapies to more invasive therapies, all of which can give you a normal sexual lifestyle.
All right, doctor, we want to let everyone know the conversation on this topic that a lot of people are afraid to talk about. It actually continues on Facebook Live right at 12:30 after this broadcast. And that's where you'll be able to ask Dr. Kershen any of your questions, or just see the questions that are being asked and watch him answer. You can always call the number on your screen. It is 855-247-7747. Again, Facebook Live right on the WFSB Facebook page at 12:30. Doctor, thanks so much for sharing the information.